Hello, everyone. My name is Edgar Betancourt, and this is my presentation on financing charity care for HA 610-7, Health Policy and Management with Dr. G. Stan Reilly, PhD, for Herzing University. In this presentation, I am the Director of Community Care and Outreach for ABC Hospital. There's various issues and problems that are occurring currently at ABC that need to be corrected and rectified, and that's why I step in to make the necessary changes. Now we ask ourselves, why does ABC need and use this charity care? Well, to provide necessary health care to all individuals that meet eligibility criteria as defined by ABC Hospital policy, a policy that I will implement. Also, to provide necessary health care to individuals regardless of race, religion, ethnicity, sexual orientation, and financial status. Also, to offset charges that are not able to be paid by individuals in financial need that are not able to pay their medical bills. Also, to serve the community as the leading hospital of choice for compassionate and patient-centered care. Our patient demographics here in the city of Cleveland, Ohio, especially in the west side of Cleveland, our patient demographics is 35% Hispanic, of which 10% meet poverty guidelines, 33% Black, of which 7 meet the poverty guidelines, and 28% white, of which 9% meet poverty guidelines. The other 4% is made up of Arab Americans, Asian Americans, and other ethnicities, which only 1% meet poverty guidelines. And although 27% meet poverty guidelines, approximately 33% of the patient population has applied for some form of payment assistance through the ABC Charity Care Program. The issues contributing to poor management of the charity care provision. Currently, there was no defined policy to determine who can write off charity expenses. Also, no defined policy to determine eligibility criteria for charity care. Also, poor or indigent patients billed for services filed as bad debt. That's bad for the hospital, as filing has to be made with the government as well as the IRS. Also, billing department not held accountable for billing errors. Claims not properly filed. About 56% of American community hospitals have nonprofit status, which is the designation that we hold. Also, it frees them of paying most taxes and allows them to float tax-exempt bonds. In return, they're supposed to provide community benefits, including free or discounted care for patients who can't afford to pay, as in our case. If a patient demonstrates the inability to pay through either direct payment or insurance, then the medical bills are considered a different case from financially solvent patients with unpaid bills. Hospitals are required to establish written financial assistance policies, and this is Policy 501c3. Hospitals under the Affordable Care Act, Sections 501R. Establishing billing procedures to correctly file claims and perform routine audits. It's a method that I will implement to reduce some of these claims not properly filed. New proposal for charity care. I will propose and establish an eligibility criteria for charity care. Also, establish a financial rating system. Those are intertwined, where we would determine the financial obligation for each individual patient that comes in for care. So we have poor patients. They might fall high on the rating scale, where they will have to pay no co-pays, and 100% of the bill would be taken care of under charity care. And then there would be other ones that we would establish some sort of financial responsibility based on income and what they're able to pay, and put them on a payment schedule. If they're not able to pay, like I said, once again, all charges would be paid under this charity care, but also to improve the filing claims in order to meet federal regulations and reduce bad debt claims. So that also goes intertwined with the first two. So we would make sure that we get the people to fall under one of these categories in the rating system, correctly identify which ones are able to pay and which ones are able to pay a percentage, and just make sure that we correctly file those claims so that we can get as much money possible to recoup some of the losses, but at the same time be able to write off the claims not as bad debt, but as charity care. Also, provide community access to preventative care to reduce long-term hospital expenses By providing community access to preventative care such as vaccines, regular well checks, and just free services like vision and dental care, we will be able to reduce the cost for the hospital and in the long term for the community and the city in general, and at the same time reduce the number of chronic illnesses and the chronic situations that participants or patients would encounter if not receiving some of this preventative care. Also, accountability. There would have to be some sort of accountability. Something that wasn't implemented in the past will have to be implemented now, especially with the billing department having multiple complaints due to the lack of the policy. So the frustration that has occurred with the providers and patients, we would have to hold people accountable. So we would put people in place to make sure to oversee the implementation of these policies, the eligibility criteria, the billing department, the financial department. We just have to work together and just basically meet up and interdisciplinary, have basically disciplinary team meetings to make sure that we can all come together and figure out what the problems are within each department and collectively figure out a way to solve these problems together. Also, increase visibility through community events and or fundraising such as telethons and health fairs. Many hospital systems provide telethons for, cancer or for cancer research, for AIDS. There could be some sort of telethons for increasing funding for hospitals for these preventative care and also these charity care costs. Also, health fairs. By having health fairs in the community, we raise our visibility in the community, and also is a way to go out to the community and provide some of this preventative care, such as blood pressure checks, health screenings such as HIV/AIDS, STDs, and just basically make sure that our community is healthy and just come to them. Providing effective care. Research shows that increases in cost sharing in the form of co-payments can discourage individuals with low income from accessing necessary medical care, which can have negative health consequences. An analysis of the Oregon Health Plan redesign implemented between 2003 and 2005 found that increased out-of-pocket costs, such as mandatory co-payments, are associated with unmet healthcare needs, reduced use of care, and financial strain for already vulnerable populations. What this entails too is, if I have to pay, I'm not going to go. So with somebody who doesn't have money in the first place, it's going to make it difficult for them to even get some of these conditions that can be taken care of at a minimal cost. They're just very discouraged to go in because financially they just can't afford, $10, $15, $20 to pay a copay. So what we would do is reduce or eliminate copays, especially for poor patients. The ones that fall into that rating scale, obviously would not pay the copay. Then we would also provide some sort of assistance for people who do have a copay, who need time to pay. We would provide we would provide some assistance with those and basically give them time to pay. Also, treat all patients equally, regardless of race, religion, creed, sexual orientation. We respect all our patients and treat all our patients with dignity and respect. We will increase the effective care in our hospital. Also, increase patient satisfaction through the compassionate care. Once again, it just goes in with the treating all the patients equally. It doesn't matter if you have money or have a ton of money. Care is care, and that's what we are all sworn into when we become healthcare providers, is to provide the best possible care to everyone that comes in our path. Utilizing charity care properly. What we would do is closely monitor spending. The spending would have to be monitored so we can know how much is being spent in the charity care and also what's being billed out as bad debt. Once again, these things have to be filed correctly. It has to be reported, the spending has to be reported correctly so that we can determine what needs to be reported to the government and we can also not lose out on government funding based on bad debt. Also, review all patient applications thoroughly and expeditiously. So by receiving these applications, we need to make sure that these are processed in a timely fashion, expeditiously, so that the rating systems can be put in place so that some of these expenditures, some of these costs are not being filed as bad debt, when in actuality it could be someone who obviously is not able to pay and would qualify to fall under our rating system to have all those costs taken care of through our charity care program. Also, reduce waste of resources. Waste of resources meaning care that typically wouldn't be necessary. The MRI screenings for for certain conditions that we've already established. Also, correspondence through the mail for appointments when we can see these people in clinic. So we would communicate with these people. Obviously, we'll try to do it through phone. We'll try to do it through regular visits, and by making these community events, we see them out in the community. We'll come into the community. So we would encourage people to come out. We would encourage people to participate, and we would just reduce waste of resources. Also, adhere to strict federal guidelines. The strict federal guidelines meaning the filing of these expenditures to make sure that we receive all the federal funding that we are able to receive and not lose out on any money. The benefits of my new plan is just basically a clear and defined policy to be implemented. By clearly defining all the qualifications, all the restrictions, our employees can follow these strict guidelines and provide the best possible care to all patients. Accountability. By holding people accountable to their positions, to their job descriptions, we can also reduce the amount of errors that is caused. We can also increase patient satisfaction, and not only patient satisfaction, but employee satisfaction within the company, through our billing department and our providers and patients. Also, increase patient satisfaction through comprehensive care that will minimize long-term spending. So by providing this care, this well-rounded care, this comprehensive care to the participants, to the patients, we would actually save money in the long run by reducing the spending, the cost of treating illnesses that can potentially become chronic and long-term illnesses. So by identifying these illnesses early on, we would be able to save a ton of money. These are my references. Once again, my name is Edgar Betancourt. I am the Director of Community Care and Outreach for ABC Hospital. I hope that you enjoyed my presentation. Have a great day.